Great question. I often have patients coming in asking me, well, how are we going to really treat this disease? And there are multiple ways to do this with an actual focus on the sphincter. I'm going to start off by talking a little bit about some therapies out there that you can look up on the internet that I don't personally perform. These are all endoscopic-based therapies. So there are things out there called endocinch, or even the transoral incisionless fundoplication. I used to perform that procedure. I don't anymore for a variety of reasons. One operation that we do offer occasionally is something known as the Stretta procedure. And again, there's information on my website about that, and you can look it up. I don't think that that's a great place to start necessarily for patients. We're going to focus more on the truly surgically based operations. And in my mind, there are two good ones. One is the gold standard, the Nissen fundoplication, and the other is the Lynx procedure. The Nissen fundoplication has been around for 60-odd years, developed by Dr. Nissen as a treatment for actually a perforated esophagus. And those patients said, hey, you know what, I had this heartburn and it went away after your operation, thanks a bunch. And so he really started thinking about this and doing these operations for treatment of heartburn. And the Nissen fundoplication is where we go in laparoscopically, 5 very small incisions, less than the breadth of a small pen. And we go in, and if there's a hiatal hernia, we reduce it, and we can talk about hiatal hernias in a second, but we reduce the hiatal hernia, and then we wrap the stomach around the top part or the bottom part of the esophagus. And what this does is it restores function to the lower esophageal sphincter. Again, this is where the disease is occurring, and we're treating the disease in that way. And this is a great operation when performed by an experienced surgeon in a high volume center. So what is an experienced surgeon? That is someone who does more than 35 procedures per year. Unfortunately, this operation is not that often performed, and we see it even less in training, but in fact it takes over 50 operations to get above the learning curve just to start out. So it's one of those operations that takes a lot of experience to do correctly. When it's done correctly, it has great results. So what we find is that over around 85 to 90% of patients are off all their medications, even at 5, 10. There's even a 20-year study out in the old open era of the excellent durability of this operation. When it's not performed correctly, it can have a whole host of potential side effects. So some of those are gas bloat, which are all over the internet and elsewhere. You can have trouble swallowing, and having dysphagia after the operation is not uncommon, and up to about 1/3 of patients need to be dilated, where they go in and stretch it out a little bit, and there can be some other ones. But in a high volume center, it's a great operation, though in my view, it's a little bit of too much operation if we can catch someone early. So, the medical community, the surgical community has been searching for something that we could do that would be less disruptive to the patient and their anatomy and as effective, and I think that's the Lynx procedure, which we'll talk about next. The Lynx procedure is really exciting because, again, it addresses the problem of the disease, which is to say the lower esophageal sphincter. So if we can catch patients a little bit earlier in their disease process, identify those patients where the sphincter is failing, then we can go in there and augment it. So the Lynx system is designed to be a dynamic system of helping that sphincter do its job. So it's a magnetic beaded bracelet, as you can see in the slide, and it opens and closes, and it really performs the function of the lower esophageal sphincter as it was really intended to be by our maker in the beginning. So the nice thing about the operation is that it is a very small device. We can again do it laparoscopically. I've even done it just through a single incision in the belly button. We go in around the esophagus. We don't have to go in and disrupt very much of the anatomy, and we place it right around the lower esophageal sphincter, and it begins doing its job immediately. Patients come off of their medications. The other nice thing about it is they're able to get right back on a regular diet. In fact, we demand that because this device needs to open and close. We have physical therapy for the device, if you will, so as it begins to scar in, it scars in a way that allows for complete opening. This device is well studied. It was approved unanimously by the FDA. It went through a very rigorous trial process, and the studies show that the relief from reflux is as good as the Nissen fundoplication. So for years we've been searching for something that's as good as the Nissen fundoplication with fewer side effects, and this is it. So our expectation is that, again, 85 to 90% of patients will be off all their medications. We know from studies done at our institution and at others that this holds true. Also, studies at our institution and others have shown vast improvements in quality of life. So quality of life of patients coming in initially is very poor relative to reflux disease, and we can improve it greatly when we place the LINX system and or any operation there at the lower esophageal sphincter.